and welcome. You're watching NDTV. I'm Rishika Barua. 5 states of Maharashtra, Kerala, Punjab, Chhattisgarh and Madhya Pradesh are experiencing an upsurge in their daily coronavirus cases. The Maharashtra government has announced some strict measures for the city of Mumbai, and 2 districts of Amravati and Yavatmal have also seen curbs after this spike in cases. Now, a new Indian variant of Covid-19 is the probable cause. What does this mean for India's fight against Covid-19? Joining us on the broadcast, we have Dr. Randeep Guleria, Director of the All India Institute of Medical Sciences. Thanks, Doctor, for sparing the time and being with us. Doctors from the Maharashtra COVID Task Force told NDTV that a new strain or maybe new strains of Covid-19 could be behind this spike in Maharashtra. Is this strain more transmissible given the fact that we are seeing such a spike?
So this is possible because we know that the coronavirus, which is an RNA virus, does mutate, and this has been seen for the last many months. We've had strains which have become more infectious both in UK, in South Africa and in Brazil. But I think it's also related to multiple factors, including COVID-appropriate behavior, which has also come down. And because of that, we are seeing a spike in the number of cases in various areas of the country. And this is something that we need to be very concerned about and take aggressive action so that we are able to contain it right now rather than having an increasing number of cases in other parts of the country.
Right. The clusters in Amravati, for instance, what we're understanding is that there are entire groups of people, families who are testing positive. The positivity rate being reported there is over 50%. How can we prevent the spread of this Indian strain?
I think we need to go back to the basic things that we were doing in the early days of the pandemic. And many of these things we have stopped doing right now. And that is why there is a huge spread that is happening in close clusters. Clusters occurs when people don't follow COVID-appropriate behavior. If you're not wearing a mask, if you're not having physical distancing, if you're not regularly washing your hands, then you will have people in your own family or in the neighborhood get the infection because it's a human-to-human spread. And if you are giving the virus a chance to spread to others who are susceptible, it will spread and cause a cluster of cases. So I think the first important thing is that we really need to look at COVID-appropriate behavior. Many of us have stopped doing that, and that is causing a huge problem because whenever we have a new strain or we have an area where you can have what we call a super spreading event, this can happen. Secondly, I think it's also important for us to understand that the virus is going to change, is going to mutate, and we should not really take things casually. We need to have the aggressive measures that we were following in the past of contact tracing, of isolation, of quarantine, which we are not doing right now. So if you have one case that is positive, we must aggressively do a contact tracing, tracking, quarantining or isolating all the close contacts so that the chain of transmission gets broken. That is not being done as aggressively as it was being done in the past. That is also leading to this spurt in the number of cases.
Right. And do you also feel that because of India's declining cases, perhaps, some amount of fatigue has set in? Many people say that, there's herd immunity now in India, so we're all safe. Do you believe that's a myth?
Herd immunity is a myth, and I'll just try to explain this from 2 points of view. One is that even if you look at the serosurveillance data, it clearly suggests that the number of people who have got immunity across the country still is not that to cause herd immunity. We still are only around 20 to 25%, whereas you need about 80% of people to have antibodies to say we're reaching herd immunity. Secondly, herd immunity is dependent on the fact that you have immunity to the virus which was originally there. If you have a lot of variants or mutations which occur in the virus, your immune response to that will fall and you will be prone to, you could call it reinfection or infection with a new variant to which the immunity is not that strong. So because of both of these, I don't think we should really focus that much on herd immunity. It is going to be a myth. We have to look at other strategies rather than waiting for herd immunity.
Well, I think that's extremely important for our viewers to understand that you absolutely cannot afford to let your guard down. I want to ask you specifically, Dr. Guleria, about this E484K mutation. This is a mutation that's been talked about. It's found in the UK, South African and Brazilian variants. Is the Indian strain similar to E484K?
It's possible. We need more data because this is based on genome sequencing. And now in India, we have 10 centers to do regular surveillance. And we're looking not only to look for this mutation, but to look at what other mutations are happening in India and be able to be ahead of the curve. So we need to be ahead of the virus in terms of looking at what are the mutations happening in different parts of the country, especially in states like Maharashtra and Kerala. Do we need to take aggressive action there because of new variants developing, which may actually be of Indian origin? And secondly, what do we need to do in the long run in terms of altering our vaccine so that we are able to have vaccines which subsequently which cover for these variant strains?
Well, I have all of those questions bit by bit to ask you, but let me first ask you about whether this new strain is more dangerous. Do we have absolutely any more information about this at this point?
So definitely strains that are emerging are more infectious, and therefore they are causing more infection. Excuse me, and therefore we need to be careful. Now, a lot of people argue that they're infectious, but they're not causing more severe illness. I again think that is not true, because if a strain is more infectious, it will cause more infection even in those who are vulnerable, the elderly, those with comorbidities, and in them, if it causes infection, they will have a higher chance of dying because of COVID-19. So if you have a strain which is more infectious, it will infect everyone, including those who are at a higher risk of dying because of COVID-19, and therefore your mortality will go up. That is why we need to be very aggressive in dealing with any strain, even if it is infectious and we feel it may not be causing high mortality right now.
Right. You know, the reason I asked you specifically about this E484K mutation was also because it's infamous for evading antibodies. The question then is, can the new variants that are emerging cause reinfection? Can people who've developed immunity, been given the vaccine, or have infection because they were infected in the past with COVID, can they get reinfected with these strains?
So that is a cause of concern which I was trying to hint at, that if you look at strains which have emerged from Brazil and South Africa, and there is some feeling that we may have some of these strains in our country, these strains have developed what we call an immune escape mechanism. That they have developed a mechanism which is able to escape the immune response that the body has developed because of COVID-19. It could be because of previous infection, it could be related to some vaccination, and because of that, they are still able to cause the infection, despite the body having antibodies either acquired naturally or through the vaccine. Now, some data suggests that some of the vaccines may still be effective, although their efficacy may come down. And since many vaccines have a buffer, that they are still, we are happy if you have had an efficacy of 50%. If you have an efficacy of 70%, you still have a buffer of around 20%. And therefore, you could feel that if the efficacy still came down to some extent, it will still be effective. But we still need to be very careful, because obviously these strains will emerge even much more as we start vaccinating more and more people, because there will be a vaccine-related sort of strain on the virus to mutate and try and develop immune escape mechanism.
All right. So immune escape mechanism of new strains is clearly a cause of concern. You know, many are saying that cases in Mumbai are rising, but if you look at Delhi, Delhi's been relatively better. The cases have been declining. We've had 2 days, in the recent past where there were no deaths reported in Delhi, for instance. Can high seroprevalence, therefore, prevent a spike in cases as far as the variant is concerned?
So high seroprevalence means that you have a large number of individuals who have antibodies and are protected. Now, that is two advantages. One advantage is that a large number of people are unlikely to get the disease because of the fact they are protected. Also, it will break the chain of transmission. So if you have a large number of people who are seropositive, that means that number of people who are getting infected are less. So suppose you have a few people who are seronegative, that is, they don't have the antibodies, but they are surrounded by people who are seropositive or have the antibodies. Then because they are breaking the chain of transmission, the virus may not reach these people who are negative and don't have antibodies, and you may not get you may not have a rise in the number of cases. That is why if you have some degree of, let's say, high seroprevalence, there is some degree of protection. But this is with the rider that I just mentioned, that protective nature should be effective, and the virus should not have developed an immune escape mechanism to bypass this seroprotective mechanism which individuals have.
All right. So even if you have antibodies or are surrounded by people who have antibodies, the new variants still have the potential to infect you. But Delhi at the moment appears still to be protected from that. Dr. Guleria, I also want to talk about genome sequencing. This is, of course, used to identify the variants, in the COVID-19 strains. 5% is the target. The government has said that they want to, carry out genome sequencing of at least 5% positive cases, but we're really falling short because only 0.5% cases are actually, being sent for genome sequencing. How important is it for us to enhance our capacities at this time?
I think this is very important as we move ahead as far as the pandemic is concerned, because now the next phase in the pandemic is being able to pick up the variants early, and this has to be done in two mechanisms. One is a surveillance for the variants by taking around 5% of the samples that are being tested, but also having a strategy that whenever you have an outbreak or a cluster that develops, as is happening in certain areas in Maharashtra, you are able to get those samples and test them to see whether there's any new variant which has occurred in that, or an existing variant which is more infectious has been reported in that area, so that you can take aggressive measures in that area. So along with the surveillance that is being done, you have to have a mapping of the country where clusters of cases are developing and do aggressive genome sequencing of the positive samples coming from that area. Combine that with the epidemiological data, the number of cases, the number of hospital admissions, the type of cases, and then you get a better picture of what is happening in the country. This is exactly what was done in UK. They found that there was a variant, but when they linked that to the number of cases in the south and southeast of England and in London, they were able to link it with this strain being more infectious, and that has led to the UK strain being identified as a more infectious strain. We need to develop a similar strategy in our country so that we are able to prevent the spread of the infection now that we are in a good position, rather than having a huge increase in number of cases and then not being able to do anything.
Right. One of our viewers has actually sent us his question: can the new strains of COVID that India is seeing, can they cause another wave of infections?
So that is always a possibility. We are in a very good position right now. But if we have new strains which come up, as happened in Europe, as has happened in UK, as has happened in Brazil, Brazil actually felt in the city of Manas that they had actually achieved herd immunity. More than 70% of the population was having antibodies. Yet the new variant caused reinfection in many of them, and now they're seeing this huge surge in the number of cases. So we need to see what's happening in the West, learn from that, and develop a strategy so that it doesn't happen in our country.
All right. Well, the million-dollar question is whether vaccines will be effective. We're going to slip into a very short break. On the other side, we'll ask Dr. Guleria if India's vaccines will be effective against these new strains. Stay with us. Welcome back. Dr. Guleria continues to be live with us. Dr. Guleria, the million-dollar question: will our vaccines work against these new variants?
Current data suggests that these vaccines should work, and like I said, the efficacy may be a little bit lesser than what we had expected, but it is still they will still be effective, and they will actually help in people not getting severe disease, having to go into hospitals, or having to landing up in the ICU. They may have a mild illness, which I think is still acceptable. Therefore, these vaccines should work, and I would therefore say that as one's turn comes, he should come forward and get himself vaccinated.
Right. Will vaccines need to be modified to fight these new strains of COVID-19, and at what point will we know whether the vaccines are working or whether they need to be modified?
So that is why we need to have regular surveillance data, because as we come to know the efficacy of vaccines based on the lab data, vaccines may have to be modified as the virus mutates and develops variants which are different and which decrease the efficacy of the vaccine. We will also need to look at vaccines which may have more long-lasting effect, and that data will also emerge during the coming months. That will also help us. There's also a possibility that we may have more than one or two variants, and we may have a bivalent or a trivalent or a quadrivalent vaccine, which has a mixture of different variants in one vaccine so that it covers for multiple strains and is able to give us protection. So the next few months we'll see probably some changes in the vaccine development, but that will be part of the process of vaccination.
Right. Well, there is a phase-wise vaccination plan that's been laid out. But a lot of our viewers have actually asked this question: when will the vaccine be available in the private market? When can you, buy the vaccine off the shelf? How soon do you anticipate that to happen?
I think what will happen is by next month, we should start vaccinating over the age of 50 years, and that's a huge number, around 27 crore individuals who will be there for vaccination. That itself is a task which will take some time. The issue is always going to be between the capacity and the demand. Currently, our capacity to produce the vaccine is less as compared to the demand. And since the demand is very high, it has to be prioritized so that the high-risk group and those who are more prone to infection are vaccinated first. But as more and more vaccines come in, and Sputnik has also Dr. Reddy's laboratory, which is doing research on Sputnik vaccine, is also now looking for emergency use authorization. As more and more vaccines come in, we may have a situation where the capacity will be equal to the demand. Once that happens, I'm very confident that the vaccine will come out into the market and we will be available for people to buy off the shelf. It may happen in a few months' time or by the end of the year. But a lot will depend depending upon the capacity that we have and the number of people that we're able to vaccinate in the priority list.
Okay. Is it safe to travel to areas where there is currently a COVID-19 spike? This is another question that's been asked by a lot of our viewers.
I would say that one should avoid that. It is not safe. We have to be careful. We don't want to bring the infection back from that area to our area and to our near and dear ones. So there is always a chance of exposure. So for the next few days or weeks, it's better to avoid non-essential travel until the picture becomes clearer, and especially those areas where a spike is being reported.
Right. The next question then is about, the Oxford vaccine being more effective now with a longer dosage gap. Do you believe that to be true? And should India therefore revisit this 28-day gap policy?
So there is some data which is emerging that if the duration is increased to some extent, the vaccine, the immunogenicity may be more and the booster effect may be better. We need to look at it more critically, and we also need to look at it logistically. So we may have data which suggests that it is useful, but then we need to see how can we roll it out and how can we change our strategy midway in terms of calling people at a later stage for the second dose. But if that is there, it can be done. And I think we just need some more data, and then we need to reschedule the second dose of the vaccination if that is required. There is some data which is coming out which suggests that giving it a little later, maybe after around 6 to 8 weeks, may actually cause a better immune response.
Right. I want to talk to you about the Pfizer vaccine at the very end. Pfizer has now submitted to CDC that it can be stored in warmer temperatures. Does this make it more viable? Also, studies suggest that one dose of Pfizer is now enough. Should India be looking at Pfizer, seriously as a vaccine candidate?
Definitely. So we need to, if we have, logistically, if it is possible, and Pfizer has said that they have now modified the vaccine so that it could be kept at a lower temperature for some time, and that may be useful in many parts of the world, because the Pfizer vaccine is something which is not practical in most parts of most parts of the world. Along with that, we also need to see the cost of the vaccine and how we can roll it out. But for India, since the population is very large, the more vaccines that we have, the better it is. So it's worthwhile looking at the Pfizer vaccine also, if it meets all the regulatory approvals, and logistically it is easy to roll it out in our country.
All right. So more the merrier as far as the vaccine story is concerned. Thanks so much, Dr. Guleria, for sparing your time and being with us on NDTV.
Thank you. Thank you very much.